What's required to be an expert in the field of bariatric surgery is a lot of time and dedication. I went through 20 years of training before I got my first job as a doctor, as a surgeon. So there's a tremendous investment in developing a skill set that allows you to perform surgery at this level. But then there's more knowledge that needs to be acquired in order to understand, one, that obesity is a disease, and two, that there are multiple methods of being able to treat it that augment each other. Yes, there's surgery, but there are also medications that can help. There are nutritional elements that need to be considered. So it takes a lot to understand this whole package and really to be able to deliver it to our patients with the quality that we do. The hope I have for my patients is to provide an environment where they feel safe. This is a big decision for people to even come through the doors. It's something that they've grappled with on the order of years before they decide to finally make a step toward health. I want them to feel safe. This is the only disease where shame has a component, and I don't want patients to feel shamed. And more importantly, if after surgery they do begin gaining weight, I want them to come back running toward us rather than away from us. I want to create a safe environment. What's at the heart of my practice is my heart. I love what I do. I love what my team does. I have a team that can address my patients' needs in every way. I've got people on my team that can address behavioral issues, physical and activity issues, nutritional issues, and our surgical issues, as well as medical issues that go along with this. So the biggest fallacy about obesity is the notion that people become obese because they eat too much and they move too little. And I think Gary Taub says it best. Gary is an investigative journalist who does a lot of writing about this subject. And he says that people don't become obese because they eat too much. He says they eat too much because they're inherently obese. And what he means by that is that they have disordered metabolism such that they handle the sugar and the processed carbohydrates that are replete in our diet to a degree that those that don't suffer from obesity aren't affected. The thing that excites me most about my work is when I get to see my patients a year later and frankly don't recognize them. Not only are they thinner, but they're healthier, they're much more confident, they're off many more medications. They are the personification of healthiness.